Good afternoon, everyone. This is Jennifer Clark, the Operations Coordinator at the New York State Coalition Against Domestic Violence. I'm going to be the first to welcome you to today's webinar on Fundamentals and Framework, Understanding Confidentiality and Our Obligations. Before I hand things off to Nasim to introduce our main speaker today, Corbin Street from the National Network to End Domestic Violence, I'm going to go over a few housekeeping items. All phone lines are going to be muted throughout the presentation, so we do ask that you use the chat box to post any questions that come up during the presentations, and we will do our best to answer as many questions as we can as they come in, but we will also have some time for a question and answer period later. We are recording today's webinar, and a link to the recording as well as the materials will be provided in a follow-up email after the webinar. We also today have American Sign Language interpreters, and we will be doing some brief pausing to allow for transitions. With that, I'm going to hand it over to Nasim Sarabandi to introduce Corbin.
Good afternoon, everyone. I'm Nasim Sarabandi. Really happy to have you here, and thank you for attending this webinar. Our main presenter today is Corbin Street, Tech Safety Specialist from National Network to End Domestic Violence, or NNDV. Some of us that worked with Corbin before many years ago, we are very happy to have them today at this webinar. Corbin focuses a lot of the work that they provide on the NNDB on TA and training on survivor privacy, confidentiality, best practices, and tech safety to victim advocates and state coalitions. A big part of the work that they provide is on the confidentiality, and we are really, really happy to have them today as our main presenters. I will put the rest of it on their hands, so thank you so much, Corbin.
Hi, thank you so much. I am just so excited to be here with you all, to be back kind of in New York, even though I don't live there anymore. I'm over in the Bay Area in California now. I worked at Niskative for a number of years, and before that worked at a local program in upstate New York. And so it's just such a treat to be able to kind of come back, even if just virtually, and talk with you all. I know I want to acknowledge a lot of the work one of our partners has done to help with this slide deck, Alicia Aiken at the Confidentiality Institute, and she's one of my mentors. So just acknowledging that much of this work that you'll see today was built in collaboration with her and the Confidentiality Institute. And I just, before we launch, I want to acknowledge this context that we're in, with so many people now working from home, with contact tracing, starting to happen, everything that's coming with the pandemic. We need to think about confidentiality within all of these contexts, right? How it all plays out. The best way to do this is to really lay a solid foundation, which is the goal of today. Everything we talk about today will be the framework we hope you use to deal with so many of the questions that are coming up, those related to COVID, those related to using technology to communicate with survivors, to dealing with subpoenas or other demands for information that you might receive, those related to how much data you should be collecting. These foundations that we go over today are really where everything else evolves from. And it's kind of the framework whenever we get TA questions that come in that we always go back to, and the lens that we look at everything through. So we're here as OVW TA providers to help you work through all these nuanced questions. So please, ask questions along the way, ask us questions at the end, ask us later through email. We're here to support you and all the amazing work you're doing and that Niskative is doing. And I today am here to give a national perspective, and I'm really excited that I get to partner up with Lorian at the end, who's going to be bringing in some of the New York specific context. Much of what I learned here, much of what I talk about today, I learned from Lorian as well. So just it's great to be kind of coming back. I'm going to now tell you just a little bit about the Safety Net Project at the National Network to End Domestic Violence. We are one of a number of projects at NNEDV, and we provide technical assistance and training specifically on how technology can be misused by abusive partners, strategies for survivors who want to use technology and want to do so safely and privately. We provide technical assistance on relocation and identity change, how to keep survivor data safe and confidential, and then how agencies can safely and effectively use technology. We also do a lot of work with policymakers and technology companies specifically around this work, how to improve the platforms that are out there that survivors are on, how to improve laws that are out there to protect survivors' safety and privacy when it comes to the use of technology. So that's just a little snapshot of who we are and what we do. In this first section today, we're really going to start connecting the dots between privacy and safety. So just to warm you all up, to get you all talking, because hopefully it's not just me the whole time. Why is privacy important to victims? If you could put in the chat some of the reasons that you center privacy in the work that you do with victims. What are the reasons for that? So I see safety. Yep, for safety reasons. And while y'all are doing that, I'm going to start moving through the safety and survival. Absolutely. Privacy is at the center of safety. Trust. Yes. Yes. Fear. Fear. To allow them control their own narrative. Absolutely. Yes. So the way service providers do or do not respect the victim's privacy can really impact their safety and healing, right? Because if we don't help them keep their information related to seeking our help private, it could compromise their safety. It influences their quality of life, their chances of being re-victimized, and really at the end of the day, and at the beginning of the day, it's their information. And this may be the first time in a long time that they have someone who actually honors that and gives them the dignity to decide for themselves. One housekeeping thing I want to point out and thank Nassim for is I have created a list of resources, and as I talk about a number of topics today in the chat, you'll see resources related to that come up. She's just put in one of the resources, Why Privacy and Confidentiality Matter to Victims of DV. So I put these in there for a deeper dive because we're going to talk about a lot of stuff today that could be kind of its own individual training. So these outside resources should help you dig a little bit deeper. So why is this victim's privacy important to you as an advocate, you as a victim service program? Of course, it matters to us because federal funding obligations require us to keep survivor information confidential, but I want to go beyond that, and I want us to get to the spirit of what really drives these confidentiality obligations that we're here to talk about today, to remember, you know, why we do what we do. When a survivor knows that you hold their privacy as a top priority, it helps build trust. They know they're at the center of your work and that your primary purpose is really to be a partner with them on their path to safety and healing. They see that you understand the risks they take by coming to you for help, and that you understand the privacy and safety are inextricably intertwined. And by educating them about their right to privacy and informing them about their options, you create a relationship based on empowerment. And when you honor that right to privacy, you're also protecting and validating their choices and decisions. I see someone typed a question in. I'm just going to read. Here is a question that recently came up: texting with clients and transmission of personally identifying information. Are many clients prefer to talk via text? What's the best way to handle it? That's a great question. We are going to dig into that a bit later in the presentation. So if that's okay with you, I want to work on these foundations, and then we'll dive into that agency use of technology, including text. Great, she says that's okay. Let me move the slides forward. Okay. So with this slide, we kind of talk about what the differences are between privacy, confidentiality, and privilege. And privacy really is the foundation that underlies the other two. Privacy is a person's control over information about themselves, right? And confidentiality refers to a responsibility and obligation from your funders that you have as an advocate to protect someone's choices about disclosure of the personal data that they share with you. So it means you should scrutinize and oftentimes challenge any attempts from outside your organization to access survivors' private information, and that you'll alert the survivor of any limitations of that protection before they share it with you, and that you'll let them know if there are any attempts to access it. And then privilege refers to a legal rule that prohibits the disclosure of private information against someone's will. So when you, in states and territories where they have advocate privilege, I don't think it's, New York is not one of them yet, but in those states, the court cannot force the survivor or their advocate to disclose information that's been shared between them. And neither the advocate nor the survivor can be punished if they refuse to disclose that information. One important note about privilege is that it's in states and territories that have it, it's the survivor that holds the privilege. And the survivor is the only one who has the right to give it up. It's not a choice that can be made by the advocate. It's centering the survivor. So in this, it kind of talks about those levels of privacy protection, kind of what's underneath them. Individuals, as we said, have a right to privacy. There may be things it's not safe for them to tell you, or they just don't want to tell you, and that's their right. Be very careful to remind survivors that they have a choice about what information they share with you. There are power dynamics at play when someone needs help, and that they may think they have to answer every question you ask because they need help from you. This is something we often don't think about, but there are unspoken assumptions at play when we start asking people questions, right? When we, as an advocate, ask someone sitting across from us who needs help questions, it can be easy for them to think that it's kind of a one-for-one exchange, that in order to get help, they have to give me what I'm asking for. You get to be maybe one of the first people that helps them start to feel a sense of empowerment and ownership over their information and the ability to make decisions about it. And then this next level, professionals, right? As professionals, we have an obligation to protect confidentiality. In this field, we're obligated to honor the trust that those who have funded our services have granted us. And it's our duty to protect the information shared with us by survivors. Doing this really helps build our relationships with the people we work with to better assist them on their path to safety and healing. And it helps ensure that we don't cause unintended harm. By honoring their privacy and by honoring our confidentiality obligations, we are supporting their safety, we are supporting their well-being. And then governments can bestow a privilege as a reason to protect social values. So when a government has created a privilege law, they're pointing to and honoring the some would say, sacred nature of that relationship. There's a general rule, and one that applies to confidentiality obligations, that courts are entitled to the information that they want. That's one of the exceptions to confidentiality, is if a court orders a program to disclose information. But when there is privilege at play, that privilege acts as an exception and a protection. It means the court is, in this instance, not entitled to access that information. Other contexts for privilege include attorney-client privilege, doctor-patient privilege, religious leaders and those that they guide, married partners. Those are other contexts that privilege is at play in. I'm just checking. And Jennifer, or Lauren, if y'all, and Nassim, if y'all will let me know if questions come up, it'll be a little easier. The way my screen looks, it's hard for me to keep an eye on all things at once. So feel free to interrupt me. So at the center here, privacy is about choice. I, the survivor, have a right to decide who knows what about me. When they walk in our doors, they aren't obligated to tell us anything. They're in control of their story, and it's our job to protect that. It's not our job to judge them if they don't want to tell us everything. And if there are things that they don't want to tell us, that's their right. And it's important for us to honor it. And confidentiality is about our obligations to protect that right to decide who knows what about them. It helps build trust. And that trust increases the likelihood that they'll seek out our support. It also protects against accidental harm, because while it may be our intention to help someone, we could really cause grave harm in this work. Abuse is complex, and what is safe for one person could be incredibly dangerous for another, right? There is no cookie cutter approach, and survivors are experts in their lives. They're experts in navigating that abusive partner. They've stayed safe up until they came to our doors. They know what's safe and what's not, right? So it's important that we believe them, that we follow their lead. Okay, now we're going to get into the specifics of the confidentiality obligations. I'll be using a lot of acronyms. You'll see acronyms appear on the slide. So this is just an overview of what I'm referencing. When I say VAWA, I'm talking about the Violence Against Women Act. And on the federal level, that's the Department of Justice and the Office of Violence Against Women oversee it. Here in New York, I believe it's administered by DCJS, the Department of Criminal Justice Services. When I say VOCA, I'm talking about funding related to the Victims of Crime Act, again, overseen by the Department of Justice and their Office of Victims of Crime. Here in New York State, that's OVS funding, so Office of Victim Services, I believe. And then when I say FVPSA, I'm talking about the Family Violence Prevention Services Act. That's overseen at the federal level by the Department of Health and Human Services, their Family and Youth Services Bureau. And here in New York State, that is funding that is administered by OCFS, the Office of Child and Family Services. Okay, so now we're going to get to what the law says. The law says that grantees and subrecipients shall not disclose, reveal, or release any personally identifying information, and that is listed in VAWA, VOCA, and FVPSA. They shall not release or reveal or disclose any individual information, which is in VAWA and VOCA, and that's information that's been collected in connection with program services that were requested, utilized, or denied. We're going to go deep into personally identifying information in a moment and what that is. Individual information is information that's connected to a person's profile separate from their name. sometimes when a name is removed, people say, oh, it's not identifying, their name's not connected to it. That's not true. We're going to talk about why in a minute, but individual information is just information that is about one person disconnected from their name. And a side note here, we sometimes get questions about abusers who call programs and harass programs, and asking if that is protected by confidentiality. But note here that based on this rule, if someone calls and harasses the program but doesn't request services, that's not protected by confidentiality. It's very specific context that's protected by confidentiality, and one that's generally only survivors are reaching out to you asking for services. So if an abuser did call and request services, that again would fall under confidentiality because services have been requested. But beyond that, it's not considered confidential. Okay. Now we're going to discuss personally identifying information. So what information can be used to identify someone? It's important here to really think beyond the obvious, like name, address, social security number. Those can clearly be revealing, but they aren't the only things, right? There is a lot of other information that can be identifying. The perpetrator's name can easily identify a victim in the context of domestic violence. A combination of demographic data like age or race or religion, and that information in combination or in context can be identifying, and this is especially true for people whose identities are less common within the community. For example, the data elements, if there was an immigrant survivor who speaks a certain language, that could be quite identifying if there are only a few people with those characteristics living in that community. And that scope would get even more narrowed when other factors like gender identity and age are factored in. So it's important just to remember that it's not just the things that are more obviously personally identifying that should be protected. It's that those unique elements as well. So to whom and what does the law apply? Well, it applies globally to any victim service program that receives VAWA funding. And this means that everyone who works under that program is bound by the obligations, not just the advocates who are funded by VAWA. It's all advocates who work at that program, everybody who works within that program. So all survivors coming to your program for help are protected. It applies to everyone who's requested or received services, and applies to all four laws related to, or all four crimes, excuse me, domestic violence, dating violence, sexual assault, and stalking. It's important to note that the obligations do not apply to crime victim advocates who are employed by prosecutors' offices or law enforcement agencies. Those crime victim advocates have certain obligations under Brady to ensure that the accused party accesses any information that can be used against them. And this could include information that the crime victim advocate has. So it's incredibly important for those advocates who are based in those settings to be clear about the limits of confidentiality, of privacy, and to provide the victim with information about how they can get confidential support from a confidential advocate at a local program. And the same is true there for forensic nurses. Again, they're collecting evidence that is not protected by confidentiality. Similarly, and this is if a court or a law enforcement agency or a prosecutor's office receives VAWA funding, they do not have to abide by the non-disclosure rule. Their decisions, the information they generate, that is not protected. However, that doesn't mean that if they reach out to a local program and ask for information that you have to give it to them. when a local victim service program is asked for information by one of these parties, the program still has to abide by the non-disclosure rule. If a court demands the information, if there is a court order for that information, that is the one exception. But we're gonna talk about the specifics of that in a bit. But it's not just you get a phone call from a colleague who works at the court and they ask for something and you just provide it to them. That is not how it works. So important to be clear on that. Now we'll talk a bit about what and when can be shared. What can be shared and when can it be shared? So the VAWA, FVPSA, and VOCA written consent rule says that grantees, again, shall not disclose, reveal, or release any personally identifying information, any individual client information, without the consent of the victim that is written, that is informed, and time limited, and that that can never be a condition of services. So we're going to talk a little bit about the circle now. This visual is helpful really in understanding VAWA confidentiality and third parties. So inside the circle of trust, we have a survivor who has chosen to interact with your program on some level. And that survivor has chosen to share certain information with staff at your program. You can share that information with anyone within the program if it is something that is done with the goal of helping the survivor achieve their goals. Anyone outside of that circle is a third party. And those are people you cannot share information with without an informed, written, and reasonably time-limited release. So this includes law enforcement, it includes child welfare workers, other victim service providers, it includes our funders, our auditors, database vendors, and so on. And we're going to put in a resource. I know that some of these things can be very nuanced. When an auditor comes in and says they want to see records, that can be a delicate dance for programs to navigate. We've got a resource that I think they're putting in the chat about that, and it's designed in a way that it can be shared with funders as well, but it's really there to help you kind of navigate that delicate dance when a funder is demanding information, and it tells you what you can share and strategies for how to navigate that relationship while protecting the confidentiality of survivors. So if they're outside of the circle, you must have a release, and that release can only be sought because the survivor wants their information shared. It cannot be a requirement of services. Also note on here, technology vendors are outside of the circle. I point that out. We're going to talk about it a little bit more later, but I want to make sure to point that out as well. So why is the third party rule so strict? Why do we have such a closed circle? Well, it's because people want information, right? And they want it for many different reasons. Abusers generally want it to cause harm. They'll go to great lengths to get it, and they'll hire others, they recruit others to help them get it. But many other parties also want it, sometimes at the prompting of an abuser, sometimes for other reasons. We could do entire webinars on how to respond to each of these parties when they're asking for information. I remember a number of years ago when I was working at NISCATIV, and we had some great content and trainings about the media when they reach out and have questions and call shelters or show up outside of a domestic violence program when there's been like a homicide in the community, asking questions. So NISCATIV has tons of great resources related to all of these. I encourage you to reach out to them. Reach out to us if any certain demands for information come up and you need help. We're here to help you navigate that. So here are the 4 types of sharing that are allowed. With the first one, we talk about how you can share within your victim services program information that needs to be shared in order to help the survivor get their needs met. That's the only purpose of sharing information. But be careful here, because this means only sharing within the victim services unit. So if you work at an umbrella organization, so as a victim services advocate, you cannot and should not share information with someone from a different program within your organization. Say if there's a food bank within the broader organization, like if it's a YWCA, for instance. Sharing across programs can't happen without a release from the survivor. Everyone within the victim service unit is within that circle, but those who work at different projects are outside of the circle. If the person, the survivor, needs you to share information with does not have the same confidentiality obligations that you do, along with the same exceptions to those obligations, you need a release. With the second one here, this is most often related to the reports that you submit. You can share information that isn't personally identifying and that has been aggregated. We'll talk a little bit more about in a moment. The third instance that you can share is when a survivor instructs you to and gives you written, informed, time-limited consent. And we'll go into detail about that in just a bit. And then the fourth is when a state or territorial or tribal law or court order requires you to share. And we'll talk a little bit more in depth about that in a bit as well. So a little bit, yep.
Sorry for interruption, because these questions are very related to the last slide. Two advocates are asking right now that what if we are in an umbrella agency and another department in our program might, for internal audit, need access to those data, and another advocate is asking kind of the same question. They're asking, what if a legal department within the organization of us wants to have access? So what is the protocol for that?
So again, if it's across departments and that that part of the organization does not is not under legal confidentiality obligations, so with the compliance department piece, they should not have access to the personally identifying information of survivors without permission. That's as I understand it. And Lorian, feel free to jump in on that as well. The legal department has similar lawyers, civil legal attorneys have specific obligations that they have to follow. If they're a part of the victim service unit, an advocate could potentially share with an attorney. But again, it all needs to be driven by the survivor. Think about it as the survivor drives the bus. It needs to be done in collaboration with the survivor. And okay, great. Lorian says that's her understanding as well. Okay. Thanks for asking questions, and Nassim, thank you for letting me know they were there. Okay, so we're going to dive a little bit into aggregate data right now. So this is specifically what's allowed by victim services funders. So VAWA, FVPSA, and VOCA allow grantees to share non-personally identifying information in the aggregate about the services they have provided. And they can share demographic, non-personally identifying information in order to comply with reporting, evaluation, and data collection requirements. And I think too, I'm thinking of the person who asked the question about the internal compliance department. I think that resource that we shared about audits could possibly be useful to you in thinking through strategies to be able to meet the need. I imagine compliance is all, it's about wanting to make sure that services are being provided in the way they're supposed to be provided, which is similar to what audits are about. I think that resource might have a lot of good information in there that would be kind of transferable to that situation of a compliance department and an agency. And please reach out to us, with any questions that you have as you read through that. We're happy to provide TA about that specific circumstance. So when we're talking about data or aggregate data, this slide, I want to make sure kind of everyone understands the difference between client level and aggregate level data. So on the left here, you see client level data. This is information about one person or one family. Client level data can be extremely easy to identify because you're giving very specific information about one person. Aggregate data, on the other hand, which is on the right side of the slide here, is made up of totals of all the people or families served within specific categories. So in this example, the program served 24 people in between the ages of 0 and 18. They provided services to 13 people in the ages of 18 to 25, and so on. But remember, and this is especially important when providing services, again, to people who don't fall into demographic majority categories, which even aggregate data can be personally identifying when you have only a few people that fit into a particular category, as we talked about a little earlier. So if a survivor, as I said earlier, I live here in the Bay Area, right? So if a survivor who identifies as Asian were to go to a local victim services program here in the Bay Area, it's far less likely they would be the only or one of the very few served there over the course of the reporting period. There are a large number of Asian folks here in the Bay Area. But if they were living in rural Mississippi and looking for help, and the program listed them as the one person of Asian descent that they've served all year, and there are few to no other folks of Asian descent in that community, it could be very easy for someone to figure out who it is. So even aggregate level data can become identifying in certain circumstances. And so be very careful as you're reporting when there are folks who are in communities and there are only a small number of those of people with those demographics in that area. Just be careful on those reports to make sure that it's not personally identifying. Okay, we're going to talk now about the specifics of informed consent. So when is a release needed? A release is needed anytime personally identifying information is shared outside of your agency. This means even if one of your community partners from law enforcement calls about a missing persons report and just wants you to give a simple yes or no. If this happens, you cannot release information. Best practice would be in those circumstances to let the survivor know that the officer called and that there's a missing persons report, and to let them decide next steps. But you're under an obligation, even in those circumstances, to not reveal information about who is at the shelter. So we're going to go into detail now about what each of these are, and we have this little saying, keep your WITS about you, WITS being just an acronym to help you remember written, informed, time-limited, and specific. So with the written piece, VAWA, FVPSA, and VOCA don't define written, but the important part is that it's on survivor-centered and informed. And this has come up a lot, especially after the pandemic hit, but it has come up for many years prior. There is no exception for oral release, but written does not necessarily mean in person, right? We have a great resource about digital written consent that we created back in March, and we'll put that in the chat box for folks who want to dive into that a little bit more. I also want to point you to the, we have a model plain language template release of information. It's available in large print, in English and Spanish. And along with that, there are advocate instructions for using that template that we really encourage you to read. Even if you've been doing this for years, it's a great way. It goes through all of the details of how to have a conversation and making it really informed. So with informed, it means that a survivor knows what problem or benefit that the sharing is going to help them address. It means the survivor was able to consider alternative ways of solving the problem. So maybe they don't need the local victim service program to share the information. Maybe they could share it themselves. It means they had a chance to consider the pros and cons of sharing the information. It means they know what information you possess about them, right? And knows what information will be shared and with whom it's going to be shared with. The time-limited piece, it means there's a definitive amount of time that the release is in effect. Ideally, it's the amount of time necessary to help solve the survivor's problem. This is not the amount of time the survivor might be working with you. Very important point there. Shorter is generally better, and a survivor can ask for longer if they want that. Specific means that there are clear, identifiable items subject to release, that it's not generalized. You're not saying all records related to housing, right? It's very specific pieces that the survivor wants shared. The survivor describes what information they want disclosed, who they want it disclosed to, and how they want it disclosed. And then the advocate follows those instructions, right? The survivor can change those instructions. The advocate cannot change them. Those are also important elements of this. We'll talk now, let's see. Sorry, my slides got a little messy here, 1 second. Okay. Okay, sorry about that. So these are the things that can be shared without a release. We've talked a lot about aggregate data, so hopefully y'all are experts on that now. I want to focus in a bit here about sharing information within community collaborations. Different partners in a community collaboration likely have very different confidentiality requirements or may have no confidentiality requirements. And each partner needs to understand their own respective obligations. For example, police and prosecutors do not need a release to speak about the case to advocates, but an advocate from a VAWA-funded nonprofit agency can only speak about a survivor's case to police and prosecutors if the survivor has signed a release of information that allows that specific disclosure. And again, remember, it needs to be specific. It can't just be in general what the advocate feels like saying or thinks is important. It has to be something that the survivor knows specifically what will be released. That said, there are things that nonprofit domestic violence and sexual assault agencies or their representatives can talk about generally that are useful to those groups, such as domestic violence and sexual assault dynamics, services that are available. You can share aggregate information and general information that isn't personally identifying. The nonprofit advocate can also gather information from those partnerships that help the survivor. And we're going to now talk a little bit about the government decides exception. So the only exceptions to confidentiality are these government decides exceptions, meaning there are times when the government decides that you have to share information with them. In these cases, if there is a statute or which is just a fancy word for law, or if there's a court order that requires disclosure, a program must comply with those. An important caveat in this is that in most states, a subpoena is not considered a court order. So when we say court order, it means it's specifically an order by a judge, and a subpoena is a very different thing. We have a resource on that in the confidentiality toolkit that you can check out. And again, we can provide technical assistance. We really encourage programs who receive subpoenas to work with attorneys, to work with the coalition to help navigate how to get those quashed when possible. Unless, of course, the victim wants you to comply with the subpoena. Again, always deferring to what does the survivor want. There are cases, there are circumstances where a survivor might want it, and those, it's important to listen to survivors in those cases as well. So if you find yourself in this position where a statute or a court order is requiring you to disclose information, there are still very strict procedures to follow around that. The program is still required to make reasonable attempts to provide notice to victims that are affected by the disclosure, and to take necessary steps to protect the privacy and safety of the people who will be affected by that release. If you go beyond the report, if you go beyond what has been requested of you, what has been demanded of you to share, then you're going beyond the statutory mandate, and it wades into violating confidentiality. So now we'll talk about what there aren't exceptions for. You'll notice that in everything we've talked about, we haven't mentioned that there are any exceptions beyond the survivor's request or that of the state statute or court order. And like I said, that includes most every subpoena. If it's a subpoena that's from an attorney rather than from a judge or a judicial official, VAWA has not made an exception for that, and no information should be released. Doesn't mean it should be ignored, though. Rather, you know, your program, as I said, you should reach out to the attorney who issued it. You can explain your confidentiality obligations and request that it be withdrawn. No information should be given to the attorney, including whether the survivor is even a client or ever was a client. And if the attorney doesn't withdraw it, the program should prepare, you know, to challenge that subpoena's validity in court. I talked a little bit about it, but if the program receives a missing persons report, you know, it's still up to the survivor to decide if they want the program to inform law enforcement of their location. And again, this is because abusers often file missing persons reports. This is a way they try to track down a victim's location. They engage law enforcement to help them track the victim. If your organization works in collaboration with any local law enforcement programs, it can be really helpful to proactively educate them about the misuse of these reports by abusers and let them know your program's policy for responding. So if you receive a report, you can and should notify the victim and help them decide whether they can safely notify the police that they aren't missing. And no secret handshakes. It also means that there's no sharing with friendly colleagues who aren't a part of the victim services unit. These rules are in place so that the victim has full control over their information. There may be a connection between the abusive partner and that friendly colleague from a different program, or that nice board member of your organization that you don't know about. And again, information getting out can potentially cause great harm. So even though we are friendly with our colleagues, we still have to always respect the survivor's right to decide. And by modeling that, we spread the practice. So just remember that. I know that can be a tricky thing to navigate. I remember when I was working in upstate New York, you know, working with other shelters, there was often like kind of attempts made at sharing information from program to program without the survivor's consent, and it's really important that not happen, that the survivor be at the center of those conversations as well. So we're protecting, and just specifics about what we're protecting. Again, this is information related to the survivor or their family, the abuse they've experienced, the types of services they've requested or received. And this is even just whether or not they've received them. You can't say yes or no on that either. And then we're also protecting the technology that creates, stores, and shares that information. And that's what we're going to dive into next. I'm just going to take a second to check in with the chat to see if I've missed anything. Take a sip of water.
So Corbin, there were like, I think 2 questions that came up and you didn't answer directly. One advocate is asking, what's the protocol for the hospital and how do they protect the victims from their abuser? It means victim information probably.
So trying to find that specific question. That again, if they don't receive VAWA funding, that's going to be kind of a separate form of obligation. I think in circumstances like this where the hospital doesn't receive funding that's VAWA related, it's so helpful for relationship building. That can be one of the best ways for hospitals to learn how to kind of safely navigate and help victims safely navigate those systems. We strongly encourage partnerships between local domestic violence programs and all sorts of community systems so that you can inform the hospital of what risks there are to victims, inform them about the ways abusers misuse those systems in an effort to track survivors down so that you can really help them kind of build up strong protections for victims. I think that's one of the best ways to help them navigate that. Was there another question?
Yes, there is another one. Thank you for that. The next question is, one of the advocates likes to learn more about if things change when a survivor is teenager or pre-adolescent, because they provide services to young survivors, and what is their rights in terms of confidentiality.
Right, and I think a lot of that can be state specific. Lorian, is there anything that you want to say to that from the state level around minors?
Yes, so I'm unmuting myself right now. And that's such a good question. And I think there's a lot of disparity across the state in terms of what programs do and how they've sort of managed the confidentiality question with anyone really under 16. So, what we can do is, I guess I would ask you to sort of hold on that question and we'll get you some definitive answers to follow up, and we'll make sure that we send that to everybody. Because in terms of shelter, remember that you are able to shelter 16-year-olds and above under certain circumstances. And providing non-residential services is kind of like a whole other matter. So if you could give us just a little bit of time to sort of put our ducks in a row and get you some information and feedback, we can give you the state laws that are relevant. As Corbin said, it really is up to the state about how all of that, what the laws and the statutes are. But in terms of practice, I know that there are a lot of programs across the state who are your peers who are navigating that in creative ways. So we'll be sure to get back to you. I've got it on my to-do list.
Thanks, Lorian. And I see there was a follow-up question. How can we implement a policy for VAWA to be in all city hospitals? That might be tricky because VAWA is federal, and there's so many people that interact with medical systems that aren't necessarily victims of domestic violence and sexual assault. But I think it's a really intriguing question. I think, talking with the coalition specifically around protections for survivors who are in hospital systems might be a great idea, looking at that from a state level or a city level. So I would strongly suggest reaching out to the coalition. I'd be happy to think some of those things through with you as well. We're going to talk now about technology and confidentiality. So when using, survivor victim service programs often use technology. You know, it's kind of just a part of our daily life. It's almost like the air that we breathe now. It can be really easy to sort of forget that there is this thing that's collecting information, that many things that are collecting information, storing information. So when using technology to store information about survivors, to communicate with survivors, it's really important to think through these questions and follow these best practices, because we're working with very sensitive data, and other people want that information, as we've talked about. And when technology is involved, the risk to information disclosure increases because access to that technology, whether it's accidental or purposeful, in some ways it's easier because there are a number of different access points and ways people can get to it. If information is in a paper file, locked in a file cabinet, locked in a room at a victim service program, there are very specific circumstances, and they're very limited on how someone could access that file, right? But when it's something that's being housed online, it's very different. It can be accessed from different computers, depending on what kind of technology it is. All you might need is the password, or you just might need it to be on something that's not secure. So it's a very different situation. So remember that to provide services, these are one of those core practices that we encourage. You don't have to write down every detail of the interaction, and you don't need to have a detailed life history. The best way to protect against harmful breaches of privacy and confidentiality is really to not store that information in the first place, because if you don't have it, it can't be taken from you and used against the survivor. Information on notes could really impact a survivor down the line. So as you're looking at kind of the practices of your organization, think through how much detail is really necessary, and think through the differences in how the information that you are collecting could impact a survivor down the line. For instance, if an advocate goes to court with a survivor, and they come back after that's over, it's the difference between writing a case note that goes through in great detail the conversations that the advocate had with the survivor as they were preparing to go in front of the judge, things that the survivor said, their emotional state, versus writing a note that says provided court accompaniment, right? If that record got successfully subpoenaed, or if it was ordered by the court that you provide that record, there's so much less detail when you say provided court accompaniment. So it's really thinking about what is needed to be collected. You can have all sorts of really helpful, important conversations with the survivor without recording the details of it in the case note. So work to limit it so that it won't become harmful to a survivor down the line. And a lot of times when we're talking about technology, people immediately think about databases, but I want to remind us that we're talking about a lot of other things as well. We're talking about hard drives on leased equipment. So every copier and fax machine and scanner now has a hard drive. And so every copy that you make, every scan that you send, there's a hard drive on that copy machine that is collecting all of those images. So those need to be purged as regularly as possible, and definitely when the lease is up. That hard drive needs to be destroyed. Data needs to be purged. This is also true with phones that you might be using. If you're texting with clients, if you're emailing with clients, survivor documents on agency computers. So if at the shelter, survivors can work on their resume or can scan documents in. Data is stored on video cameras now, right, of survivors interacting, moving in and out of the shelter So again, think about all these places that survivor data lives, map those places, know where it's collected and stored, work with IT professionals to protect it, work to erase it as much as possible, because how you store your data really is how you secure it. And you want to make sure that in all the places that you're collecting this data, that there's strong security, but also, that it's being deleted as regularly as possible, because again, if you don't have it, it can't be used against the victim, it can't be breached. Now we're going to cover some essential questions that come up when selecting a database. And there's a resource. We have tons of resources on techsafety.org about databases, both selecting databases and using them. So one of the important questions is, when you're talking with database companies, who owns the data? Because remember, the information that you're collecting, that's the survivor's data. If they choose to share it with your agency, it's still inside the circle that VAWA created. And it's vital that in conversations with vendors that you get clear that the data is owned by your program, that entering it into the database will not transfer ownership of that information to the database company. Another important thing is to find out who has access to it. Can anyone at the software company see the information that you're putting into the database? Remember our circles earlier, and database vendors and their employees are outside of the circle. If they can see the information that's being put into the database, that could potentially be a breach of confidentiality. You also need to know where the data lives. Will it be stored on your own servers within the walls of your program? Is it stored in the cloud? And when I say cloud, a lot of people are like, what is this mysterious cloud? Well, the cloud is just someone else's computer connected via the internet. So when you're storing something in the cloud, it's being stored on someone else's computer. It's being stored on their server. So finding out the security measures around that, finding out who can access it, how it's protected, all are incredibly important. And here are some of the best practices that we talk about around data collection, retention, and deletion. Again, this is always within the context of your role and how much protection a victim has by nature of your role. It's going to differ if you're a case manager at a local program versus a civil legal attorney. For case managers and advocates at local programs, again, remember that to provide services, you don't have to write it all down, and you don't need to have all those details. Delete as much as possible, as soon as possible. With hotline calls, you aren't recording those, right? And then saving files. Every hotline call that comes in, those don't get automatically recorded and stored in the survivor's files. Those are anonymous, and they should be anonymous. And it's important to treat other conversations that happen via written word in the same way that you would conversations that happen in a spoken word. This can help also help avoid accidental sharing. If it's gone, if the text chain is gone, if the email chain is gone, you can't accidentally forward it. It can't be subpoenaed by an abuser or used against the victim. So again, minimize collection and retention. Delete as much as you can, as soon as you can, within the constraints of the law and your funder's guidelines. Those are important things to consider here. And sometimes people hear us saying minimize it as much as possible, but they don't hear that we're saying do that within the constraints of the law and your funder's guidelines. Those are important pieces to consider in that, and we understand that. Also guard against accidental leaks. Like forwarding an email with survivor information to the wrong person. And if you do mistakenly do something like that, it's important to have a data breach response policy in place so that you have a plan for what to do when that happens. I got a TA call recently where someone accidentally forwarded the wrong information to someone at HUD. So they forwarded a survivor's information that they shouldn't have to HUD. It was a part of an attachment. They thought they were sending a blank form, and instead it was a form that was filled out. And so we went through and talked about how to safely inform the survivor of that breach, to find out, are they still at the local program? Are they still receiving services, or have they left? If they've left, it becomes a lot more complicated because reaching out to a survivor, we know that's incredibly complicated. They may have gone back with the abusive partner. They may be living with roommates or with family that don't know they access services. And so it can be really tricky to try to reach out to them after the fact. So these data breach response policies, it's important to have these in place, to think about it in advance, to think about how to navigate those kinds of notifications safely. And again, best to avoid them at all costs when possible. Let's see. We're also going to talk here about agency or use of devices. So another best practice is that employees should be using equipment that the agency owns rather than their personal devices. Again, this is best practice. And this is because intermingling victim information on personal devices can bring up major confidentiality concerns. Having a survivor's contact information on the device and maybe even backed up to a personal cloud account or showing up on a personal phone bill. If friends or family pick it up and see the personal information of victims, that's a data breach. That's a violation of VAWA confidentiality obligations. It's also much more difficult, if not impossible, to really systemize the procedures for safekeeping of devices if they aren't owned by the program. You can't control if someone puts a passcode on their personal device, or if they're updating their software, or if they're regularly purging information related to victims. You can't be sure that all personal information has been purged from devices and accounts of former employees. You can't lock the device if it becomes lost or stolen. All of that is out of the agency's control if it's on the personal device of an advocate. And then there's also a chance that that information, that the information on the person's device could end up being subpoenaed or subject of a search warrant. And I'm sure folks don't want their personal information to be caught up in that. So we always talk about how when using technology to communicate with survivors, if it's online chat, if it's email, if it's text message, the important thing is that you notify survivors of the risk related to that specific technology, that you offer them other options that could be safer for them, and that you, if they decide to move forward with that technology, say a survivor wants to use email, you've let them know that that's not necessarily the most private. You've let them know all the risks related to that, and you say, you can give us a call, or you can reach out on our secure chat line, and they still want to use email, move forward with that. If that's what they want to use it. Don't say that you're not going to use it, right? We don't want to cut off communication with survivors. We want them to lead the way. They drive the bus. But when you do that, just be sure to delete it after the conversation is over. Delete the content, go and empty the trash bins out, right, of the email account. It's all about making yourself accessible, making it so that survivors can connect with you, and then working to protect their information so that it doesn't leak out. And we're kind of towards the end of this, just summing it all up, and then we'll go into any other Q&A and talk with Lorian. So some guiding principles, the fundamental role and goal of the advocacy profession is to facilitate the empowerment of survivors, right? You give them the information they need to be able to make a decision for themselves. You let them know any potential consequences that might come up if you're the one to disclose the information. Let them know who it's going to, the reason for it, where else it could go after that, right? Because once you've shared information with another organization, there's a chance that that organization could further share it. But you don't have any say over that once it's out there. Remind them that they can share the information themselves, and that by doing so, it keeps their connection with your program private. Empowerment of survivors means that the survivor's needs and the survivor's ability to make decisions about how they engage with the world is really at the center of the relationship. And it means that the advocate's primary interaction is with the survivor, not with the outside world on behalf of the survivor. So give them their power back. Don't force them to give you information, right? Don't force them to turn it over to anyone else. Don't turn over information without their informed consent. Don't make decisions for them. It's up to the survivor to decide what's safe and what's a risk, and they're in the best position to weigh the consequences. With that, Lori, well, we can open it up for questions, and Lori and I can pass it over to you as well to go through the New York pieces when you're ready. Just looking through the chat here to see if there were any questions that came up. So I see one. Currently, we are trying to explore platforms to use in providing services virtually. We are thinking about switching platforms. The one we are currently using is secure but very difficult for survivors to use. We're being requested by staff and clients to use Zoom. The Zoom is currently in its beta testing phase for end-to-end encryption. What would you suggest to ask before making a decision? I want to point you to some great resources that we've got on our techsafety.org website that go specifically into some of the different platforms that are out there and available. We can't recommend any specific platforms because, as you know, the security standards change from day to day, but I'd be happy to walk through some of the specifics of your situation through technical assistance. That might be one of the best ways to have this conversation so that we can make sure we can talk about some of the New York context. So I'll put my email address in the chat.
And Corbin, we do have a question, and I know that we made a decision in the time that we have not to go too deeply into record keeping and case notes, but we do have a question about, if you could sort of do a quick overview, confidentiality and case notes. And I did ask for a little bit more context so that we could be, really specific. Because so many of us are working remotely. So I think it does have to do with this sort of new remote workplace situation that we're in.
Right. I mean, sort of the best practice standard is put as little in the case note as possible. Again, like we're centering the needs of the survivors. Oftentimes case notes can be about the needs of the program. And we can kind of get out of survivor-centered thinking and think about agency-centered thinking. So going back to putting in, the minimum amount necessary and really framing it in a way that would not cause harm to the survivor. So if you're having a conversation with a survivor who's struggling with substance abuse, potentially, and you put in a lot of detail into a case note about what that survivor has talked about, that could really endanger the survivor. It could endanger their relationship with their children if those records get out. So rather than going into great detail, you could we talked about possible support around substance use. Just keeping it vague, so again, that you don't unintentionally cause harm to a survivor. Okay, and Lauren, I can advance the slides to the New York section?
Great, thank you.
Sure.
Yeah, could you go to the next one? I think these got reversed. So we'll start with the next. Thank you very much. Well, hello, everybody. Thank you so much for joining us. It's good to have you all on this webinar, and your questions have been excellent. Thank you, Corbin, for making yourself available and sharing your expertise. I'm really just going to speak briefly to where we are at in New York around compliance with our federal statutes that you've heard Corbin talk about today. So as Corbin mentioned, for years, we would deliver training just like this and technical assistance on confidentiality and record keeping, holding up the federal statutes and confidentiality provisions. And then we'd have to sort of backtrack and say, however, here in New York, things are different. And don't tell anybody that we're not complying with federal statutes, you know, and the requirements of our federal funders. But the good news is we are now in compliance as of April of 2019. So this is not news to you. These long-awaited changes to laws really helped us eliminate, you know, a mechanism for funding that was really problematic here in New York. We're not at the end of the tunnel yet for working through all of that. But as you know, for 3 decades, programs were paid for sheltering through that per diem reimbursement process, which required survivors to apply for public assistance. This, as you can tell, and as you know, was inconsistent with the FVPSA requirements. And because FVPSA is the main funder for all of our shelters through the New York State Office for Children and Family Services, there was something that needed to be done and needed to be done for many years. So given that inconsistency, well, that non-compliance, and given that our continued funding with FVPSA was in jeopardy, amendments were made to sections of the social services law, among other things, which lifted the requirement that survivors of domestic violence had to apply for temporary assistance in order to pay for the cost of emergency shelter and services at a shelter program that you were providing. Parenthetically, it also eliminated the requirement that programs could charge survivors a share of the cost of shelter, which had always been an option, which most of you did not do, but some of you still relied on when there were non-payment issues. So these laws were made effective in April of last year, and ADM was released in June 14th. So there was a little bit of a delay in practice. So policies and procedures took a bit to catch up to these new strengthened provisions, and emergency regulations were passed. This allowed programs to truly protect, you know, personally identifying information. At the time, OCFS also released a template consent form, a consent for release of information. So Corbin did such a great job sort of describing what a release of information ought to look like. OCFS also sent around a brochure which programs could give survivors, explaining all of this and which benefits and what benefits they might be eligible for. So that was all sort of done at the same time. So if you could go to the previous slide, we know that there's a wide variety of how this is being implemented across the state, even a whole year and a half later. And we just want to make sure that you know that our lines are open, as well as OCFS, to hear feedback about how implementation is going. So OCFS and the Office for the Temporary Disability Assistance is really interested in hearing about any kind of glitches in the system and sort of help to clarify, you know, at the state level, what the local districts are meant to do. So what we've learned from all of you is that you're really relying on a screening and intake procedure to make sure that survivors who are thinking about coming into emergency shelter really understand what their eligibility is and what the benefits might look like. And so we've heard some really great creative policies and procedures that you've integrated, with an acknowledgement that there will be survivors who will want and need to apply for technical assistance because they've not been on it yet and may need those services. There may also be survivors who are already on temporary assistance and they want to keep those benefits. And then of course we have a third option, which is there are some folks who may have SSD or SSI and may not need to apply. And so, you know, one of the things that I've learned from many of you is that folks have been declining applying for temporary assistance because they're okay, they've got access to other resources. So I just want to wrap up with saying, you know, sort of extending an invitation for you all to continue to reach out to us, to provide feedback, to talk about practice, to describe any glitches in the system that may still be happening, or for more information that you might need to nudge your local districts along. And so last year, the day after OCFS did a webinar, Joan conducted, our Director of Public Policy, conducted a webinar sort of describing these new provisions and did invite you and ask for some kind of specific information. So just very briefly, what we're interested in knowing is, you know, have there been issues that you've experienced in terms of getting paid? Have there been errors in payments? Again, you know, based due to this new law. Are local districts still requiring daily sign-in sheets? Because if they are, they should not be doing so. And OCFS is interested in that information. Are you having issues around districts determining who the district of fiscal responsibility is? So that is something that people were worried about. And one of the things that NISCATIV maintains in terms of a concern, are there issues with survivors moving from one shelter to another across counties in terms of maximum length of stay and how that gets enforced and whether or not you're getting paid? Because again, if we're not providing personally identifying information, how do the local districts know? So I think that's it for the information that I wanted to convey. And if you have any questions, please, you know, make sure you put them in the chat, either for Corbin with all of the wonderful information around the federal statutes and best practice. If it's New York specific, we'll do our best to answer as well. Thank you, Corbin, for you know, everything that you've shared. I think it's a lot to absorb. I'm beginning to think we might need another follow-up webinar just to address some of these wonderful questions that have come in.
Yeah, absolutely. And there are a lot of great, like, deeper dives that we could do into a range of topics on this.
Corbin.
Yes.
Hello. So there is this question that usually comes up when we talk about data retention. And one of the advocates is asking for how many years we have to keep this data on file. Is it 5 years? Is it 7 years? So it's not very clear for them.
Those questions come up a lot, and 7 seems to be this kind of magical number that would not a lot of, I haven't been able to find exactly what kind of originated that, but the short answer is it depends. It's going to depend on your funder's requirements. So that's what you really need to look at is on for each of the funding sources that you have. What are their requirements related to record retention? And it's really important to dig into the details of what kinds of records they're talking about, because some require that only financial records be kept for a certain amount of time, and other things can be purged. So it's really important to not only find out how long, but to really go into the details of what specific information you have to keep. Very often it's not the whole file. So again, back to that practice of getting rid of what you can as soon as you can, and keeping what you have to based on the requirements of the funders. And so that's going to be different across New York State. Lorian, I know that it used to be OCFS required programs keep the files kind of indefinitely until the program shut down, but that thankfully due to advocacy has shifted. Can you update us on some of those new requirements?
Yes, thank you. It is in the regs. They did expect us to sort of just keep those records forever. I think it was even, 7 years beyond the time that the program closed. So I guess our basements would have been, and our attics and storage units would have been filled with records. So yes, the regulation, it is in the regulations now. It has changed, and it is 7 years, which is in comportment with, all of the other OCFS funded programs. So foster care, child care, juvenile justice, juvenile homes, all the other things that they fund. And so the last iteration of the regs made that change finally.
Great. So it is 7 years. There you go. And is that the full file, or is it certain elements?
So there is, those were actually, it's very specifically about personnel files as well. So, and Joan is, reminding me that operational records must be maintained for at least 6 years. So this does not fly in the face of the recommendations that you've given, Corbin, today around electronic files and around whether or not we're keeping records of hotline calls, which you've clarified we should not be. They are meant to be anonymous. So personally identifying information is not something that's collected during a hotline call, but the numbers are something that the funders are interested in. So those kinds of records we're talking about in terms of management.
Okay, and great.
We'll follow up with the how long records need to be maintained.
Great. And I think this just like connects those dots back to, again, what are you keeping in the file? How much detail are you putting in it? Because you're going to have to keep it for a while, right? And the risks for the survivor are going to be present as long as that file is in your possession. But if there's less private, less detailed information in that file, it's less risky for the program. I mean, for the survivor. All right. Well, if there's, we can give it another minute to see if any other questions come up. I'm going to also just put the contact information for our project up and my email address. If you have technical assistance questions, reach out to Initiative, reach out to us. If you email me, it might take me just a little bit longer than if you email our team. If you email the whole team, you have 7 people looking at your email. So feel free to email the whole team if it's really time sensitive. But I'm also happy to take individual technical assistance requests as well. Let's see, we got one more question. How would you reconcile not creating detailed case notes and advocates preparing support letters that are fact heavy for legal cases? Lorian, do you want to, I know you've done a lot around things that are connected to this with legal cases.
Yes, and I see and I really do want to answer it. I find this, it's one of the reasons I asked a few times in the chat box, what is the context? And it's one of the reasons that I think maybe we do a deeper dive on maybe record keeping and case management in the very, very near future, because honestly, context is everything. And what might make sense for one program to do because they have legal services and attorneys on staff may not be something that is appropriate for staff where that kind of programming or services aren't offered. And so I don't want to demur. I do want to answer the question, but I think we may need a follow-up conversation. So Alicia, I will absolutely follow up with you to answer that question specifically with you as an individual, but we'll definitely add this to the topics that we need to follow up on with really concrete information.
Great.
You know, again, when a survivor is asking you to share information and to help prepare court documents, petitions, timelines, and they've given you permission to do that, that's very different from sharing information during a civil or a criminal court proceeding that you've not been given information or permission to share. So anyway, it's sort of more of a longer conversation.
Great, thank you, Lorian. And I see that we're at time. Did y'all want to take us out? Didn't know if there are any other things Niskadev wanted to point out before we close.
Well, thank you so much, Corbin and Lorian. This was great.
Yes, thank you so very much to our presenters and to our ASL interpreters today, Mike and Gloria. You will be receiving a follow-up email, which will contain, again, a copy of the recording, the presentation slides, and a list of the resources that were shared in the chat box. So thank you again, and I hope if you can take just a few moments after we close the webinar to take a brief survey, that would be very helpful. And have a wonderful afternoon, everyone.
Yes, thanks everybody.
Thank you, everybody. Thank you, Corbin. Thank you, staff. Thank you, interpreters. We'll be in touch.